How stem cells work is your body gives off a signal when you're in pain. And so what stem cells do is they essentially, when we inject the stem cells into the body, they go in and they basically home in to that area. And so the body gives off signals, stem cells go into that area and they start bringing in proteins and other what are called cytokines and other secretions to help repair and regenerate the tissues. It's just like the body does with any other type of injury, but with stem cells we can essentially supercharge that process. There's different types of stem cells. There's amniotic stem cells, there's adipose stem cells, there's bone marrow stem cells, and there's umbilical cord stem cells. The stem cells that we use here in the clinic are umbilical cord stem cells, and the reason why we chose to use those is because they are the youngest stem cells and they are the most robust and lively stem cells. And if somebody has an issue with degeneration, their body's ability to regenerate is not there because there's two things that happen as we age. Number one, we have less stem cells. Number two, they don't, what's called the doubling time, they don't double as quickly, which ultimately means that they're not as robust as those when we're in our younger age. So we take umbilical cord stem cells, live healthy birth, live healthy mom, and we take those, the lab processes those, and then we inject those to the patients.